So the residency program, I think, has a core responsibility, a core strength, perhaps we might say, in helping residents be successful as teachers. That leads us to a number of different initiatives that have been developed to help residents gain teaching skills.
The teaching skills curriculum kind of combines skills that you need for being a future medical educator. That's combined with something I'm the director of, the teaching resident rotation, and that's a dedicated 4-week rotation for third-year residents to specifically teach and use those skills that they've garnered through the teaching skills curriculum.
We also have developed teaching sessions that look at how to engage an audience or how to get the most out of your PowerPoint slides. So there are a number of different topics that are included over these 3 years.
It's dedicated teaching time that really lets them focus and develop those skills. They use, different modalities, whether that's teaching a didactic session or whether that's leading a simulation session or leading a small group discussion. They interact with core clerkship medical students as well as sub-interns through their didactic training.
In developing this curriculum, we realized, or we took into account, the fact that these are adult learners. And just sitting and getting didactic information is not useful, and it's not exciting for them. They aren't as engaged. So the hour teaching sessions that these residents have once every 10 weeks is a very short didactic presentation or discussion of topics, and then they launch into practicing. So it is maybe a role playing, maybe it's just a discussion with feedback, practicing some skill that they have been introduced to. And then at the end of the session, they're asked to commit to trying a component or a portion of that skill the next time they are with learners.
Sometimes they don't realize how much work goes into the preparation of a 1-hour lecture. And so a lot of times on the wards, it's a 5 to 10 minute chalk talk that they'll do with the medical student, and then they'll move on throughout their busy day. But being the dedicated leader of a teaching session that's scheduled for an hour long, you have to do a lot of preparation, almost 3 times the preparation time to do that 1-hour session.
So we have what is called the Distinction in Medical Education program. The program is designed for first-year interns, first-year residents to apply, and then the program itself is the second and third year. The Distinction in Medical Education program, I believe, is probably unique. I have not heard of other departments doing it. The College of Medicine offers a master's degree in medical education as well as a certificate. So I think a number of residents from different departments and even faculty have taken advantage of that. But as far as having sort of a tailored program for a subset of the residents who are really interested in education as part of their portfolio, might be a new and unique idea.